Today is post-op day 7 from the tummy tuck surgery. For those who are new to the channel, I lost 158 pounds in a year, and I had a bunch of loose skin to deal with, which is why I got my chest done earlier, and now we are dealing with the tummy tuck recovery. And first things first, I'm about to get on a call with one of the nurses from Dr. Law's office so that we can chat about the drains. This one is still producing around 50-ish, 40 mils every day. This one actually only produced 20 yesterday, which means that it might be time for it to come out. So I'm just gonna weigh myself quick to see how the water is moving. Holy shit. That means we're down 7 pounds since yesterday. Do you guys like my little setup? I just taped one of the mics to the phone so you could hear it while I record it. Hello.
Hi Simon, this is Casey. How are you?
I am great, how are you?
I'm doing well. So how's your recovery been going this week?
It's been really easy, honestly. I expected this to be a lot worse than the chest surgery, while this has actually been a breeze.
Oh my gosh, that's so great to hear. So you haven't had to use any Percocet?
I used a couple just to sleep, I think 3 nights, but it was just because it was just tight and I just couldn't fall asleep. And but for actual pain management, no, not at all. There is one interesting thing of pain that's been recently occurring, but I think it's kind of funny. So because that most of the inflammation and the water holding has been in my legs are starting to look a little sausagey. Funny enough, I'm sure it's because of the fat grafting to my pubic region, but my testicles feel as though they're very pressurized, if that makes sense. It's not painful, but it just feels like somebody's just flicking them all the time. You know what I mean?
Oh, well that's no fun, but that is normal to have some swelling there. So hopefully that will subside in the next couple of days.
That's what I figured.
So what about your drains? What has the output been, not today, but yesterday and the day before for the left one?
So the day before, I didn't actually record it just because of the fact that I was traveling and I was walking and running and it was kind of crazy. But yesterday it drained, I believe, wrong paper, 1 second. So yesterday, my left one actually only drained, it was between 20 and 25. And my right one was 45.
Okay. So if your left one today is 20 or less, then you can take the left one out.
And it's the same thing. There'll be a suture holding it in place. I cut it, remove it, and then put a gauze on there and stick it there for a couple hours?
Yes, make sure you take it off of suction before you pull it, or it'll be uncomfortable when you pull it.
Right.
If you just open up the bulb and put the cap back in so it's inflated, there's one black suture, just cut that and then pull the left one out, but leave the right one in.
Of course.
So you also have some sutures in your umbilicus, in your belly button, that half of those can come out today. Do you have somebody that can help you with that?
Yes, I'll get Taylor to help me do that, so that's no problem. After those are out, do I put back another gauze and a Tegaderm on top?
Why don't you do that until the next week when you take the rest of them out? And be thinking about this too, Simon. You might want to find something like a bead, or I had this done myself and I found a little pebble that I cleaned off. And after the umbilical sutures are removed, you might want to put the bead in there, something just to keep it open while it heals. Does that make sense to you?
Yes, I've heard about people ordering belly button plugs on Amazon.
It's not that deep though. You don't have to get a belly button plug. Any bead that'll fit in there. And like I said, I literally found a little pebble on the ground that I cleaned up, and then I just taped it in there for a month.
Oh, wow.
And that's just to keep it open while it's healing. How are you doing activity-wise?
I'm walking fine. There's only a singular spot on my right side that hurts a bit when I get out of bed, but that's literally it. Otherwise, I'm fine.
That's normal too, because he did all that work in there. It sounds like you're doing really well. Do you have any questions for me?
At the moment, no.
Then we'll talk next week and see what the right one's been putting out, and hopefully you'll be able to get the right one out then too.
Perfect. What's the output that we're looking for to remove it on the right? 20 as well?
Yes, 20 times 2 consecutive days.
Perfect. Amazing. And then I guess a question just for the audience would be like, how long can we expect the general like abdominal and leg swelling to stay for? Because obviously it's just like water holding, but how long does that typically last?
I think that you'll be surprised next week at how much better it is than this week. It's different for everybody, but it does go away gradually every day.
Oh, perfect. Awesome.
So the reason that we're pulling the drains at different times, that right drain will take over all of the drainage now. So we keep the drains in because your body can absorb 20 cc's a day on its own. So once the drain is only putting that out, it's safe to pull them.
Right. And is it 20 cc's for the 24-hour period? Because I emptied my drain right before going to bed last night.
Yes.
Okay, perfect.
It's 20 cc's for the whole day.
Perfect. Amazing.
All right. Thanks, Simon. It's so nice to talk to you as always. I'm glad
You as
your
well.
recovery's going well.
Thank you so much. All right. Have a good day.
Take care. You too. Bye-bye.
Bye. All right. So this drain might come out tomorrow if this is less than 20 cc's. So I'm just going to weigh myself quick to see how the water is moving. Holy shit. That means we're down 7 pounds since yesterday. Oh. Now for the next section of this video, I'm going to tell you the 10 questions that you should definitely ask your plastic surgeon before actually going through with any surgery. And yes, I wrote them down on my phone. I don't want to mess it up. Now, I kind of split this up into 5 different sections with 2 questions in each part. The first one's going to be the scars versus the results. And then we have the safety and credentials, recovery and lifestyle during recovery, the long-term considerations, and then the last one being cost and the logistics of it all. And every one of these parts is really as important as the next, so pay attention or write it down. You know what? I'm just going to throw them in a Google Doc afterwards and throw the link in there. You guys can just go check it out there if you want. And the first question is, where will my scar be and what is it going to look like? And this is super important, before getting my surgery for my chest, Dr. Law literally showed me with a pen on a call before, and he was directing me like, this is where it's gonna go, this is what it's gonna look like. And then obviously showing me some of his previous results. This is what my previous results have looked like. This is what you can expect after week 1, after month 1, after year 1, year 2, etc. To really let me know, to have a very good realistic expectation of what is to come next, with the second question being, what results are realistic for me? You have to understand, your result will not look like the same or will not look like the next person, because we all have individually crafted different looking bodies. I already had a very large amount of muscle mass, which is why my chest already looked very popping after the fact. If you look at somebody with a less developed physique, let's say progressive overhaul, he had less gym experience than I did, which means he had less muscle mass. So obviously his chest looks a lot more flat versus mine already had that 3D look because I was benching close to 500 pounds in college. So don't settle for a one-size-fits-all answer. Make sure to get some results from your surgeon, from people that have a very similar body type as you going into the surgery, so that you actually know what you're getting into. Coming into part number 2, safety and credentials. Is this doctor board certified in plastic surgery? You would be surprised at the amount of times that this question is skipped, and at the amount of times that some more shadier doctors can get away with doing work without actually being accredited for it. Ask the damn question, look at the certificate. I lied, this part has 3 questions. The second question being, how many times have you performed this exact procedure? Make sure that you're not the test dummy. This isn't their first time doing it. You should absolutely have an entire catalog of previous work to make sure that this doctor is good at what he does. The reason I first found Gynecomastia by Dr. Law, first of all, that's his Instagram handle, so really easy to find. But 2, I knew it was gonna make sense for me because on his Instagram page, all he had was a bunch of amazing results of gynecomastia total excision surgeries. So you're not going to go get, let's say, a tummy tuck from a doctor who only specializes in rhinoplasty, which is nose jobs, right? That just wouldn't make sense. You would want to find a doctor that is very good, that gets results in what you are looking to get done. The reason I'm with Dr. Law for the chest and my tummy tuck and my back surgery is because go look at Homie's website. He has results for all of them, and they're all crazy good. And then this is another important thing to know. Where will the surgery take place? Is it going to be in a private clinic? Is it going to be in somebody's garage? Is it going to be at a hospital? These are things you have to know. And these are also good things you have to know for later because this will impact the cost. And then moving on to number 3, the recovery and lifestyle portion of it. You should have a very good idea of what your recovery is going to look like. Dr. Law drilled this into me so many times that I can tell you that for my gynecomastia and for my tummy tuck, it's actually very similar. For the first, we'll say 3 to 4 days, I am just walking around. I'm not doing much. I'm definitely not lifting anything. After 2 weeks, I start introducing my cardiovascular activities, which is using the elliptical because there's a lot of less shake, a lot of less pressure added to the body. And then week 3, and then week 4, that's when I can start introducing more active style of cardio. So that would be like treadmill and such. Week 5, I know for a fact that I can then start isometric movements, so very light weights, getting back into the gym. And by the end of week 6, after gradually increasing, I am good to go. If you don't know this information before going into surgery, you fucked up somewhere. And then the next question for this part is, how painful is recovery and how is pain going to be managed as well? And just a little bonus on top of that, how long is it going to take me to get back to work? We all need to make money to live. How long will you be off work? Do you have the funds available to be off work for X period of time? But for the how painful the recovery is going to be, you should know if your plastic surgeon has a very comprehensible approach to pain management. I was taking pills leading up into the surgery, and then after the surgery, I knew exactly what I was going to be taking, when I was going to be taking, and how much of it. I knew that I was going to have breakthrough protocols in the form of opiates, but I also knew that I have to take my Celebrex for 7 days post-surgery, twice a day. And then, is your doctor using a long-acting local anesthetic? In my case, it was a compound called Exparel, which lasts for 3 whole days, meaning my entire core section was completely numbed out for 3 days because of the fact that he did the ab work on this section. And because of that, I didn't feel any pain from the day that I was done surgery to now, except for my balls. That kind of sucks. And then part 4, long-term consideration. What happens if you gain or lose weight after your surgery? That's an important one, because if you gain a bunch of weight afterwards, you're just going to cause the same damage that you did in the first place going for your surgery. And if you lose a bunch of weight afterwards, then you might have done it too early, and then you're just going to have more loose skin accumulation, and then you'll just need some sort of revision, which we obviously want to avoid. The less times under the knife, the better. Coming into the next question, will I ever need a revision? Sometimes some doctors will do some procedures knowing that your job isn't totally done. As an example, I have a client and he has a very large hernia that needs to be removed. At the same time that this is going to be removed for quality of life, a plastic surgeon is coming off to take a very large amount of skin in front of his pubis area. Chances are that but he has a lot of weight to lose still, quite a bit. So even if he does get this chunk of skin removed in the hernia, if he keeps losing more and more weight, he will still produce a minimal amount of loose skin, not nearly as much as what he has right now, but this just to know that revisions might need to occur depending on when you get your surgery. And part 5, this one's super important and you cannot miss this conversation. And I know it can be very uncomfortable talking about money, but you need to talk about costs and logistics, because you need to know what is included in the price that you are presented with. They need to be ultra specific. You need to know about between the surgeon fees, the anesthesia fees. Is there a facilities fees? Because if you're doing it at the hospital, it'll cost them a different amount than if you're doing it in a private facility like what I did with Dr. Law, which is in his own office. He has a surgical room right there. Are there any garments you have to wear? Let's say this right here, or the weird chest compression tank top shirt thing that I had. That costs money. So you need to know, is this all included, or are they going to try to nickel and dime you afterwards and try to upsell you? These are things you have to know. And then this is probably the most important one. If complications happen, who is going to cover those costs? If there are any complications that happen, who is covering the cost for that or for the revisions? Because trust me, you do not want to find out the hard way. Because I assume that you would not want to find out the hard way. So just ask the question. So if you are considering to go get plastic surgery, make sure to have all the information. Write these down or print out the paper that I'm going to put the thing in, and make sure to ask the questions. You want to make sure, because you are putting your health and your future confidence in someone else's hand. Is this the right person? You want to make sure. So if you made it this far in the video, drop any emoji in the comment. I would love to see how many of you actually made it all the way here. And as always, let's change the world together. And I'll see you all tomorrow to see if we get to remove the drain or not.